Don't do these 7 things in any hospital.
Health insurance, CT scan, not compatible. Health insurance, chest X-ray. But why would you call her
Marvelous?
You think that works in my mouth?
Male nurses, male midwives, or midwives.
Or you have vaginal discharge, where you say you have a teary eye. It's giving eye drop. So tell me why someone going for surgery in less than 24 or 48 hours has eaten kenke or has eaten fufu.
And then we see
Bankusinet for a die queen inside.
2.5. Don't ignore visiting hours. Again. Don't ignore visiting hours.
This point.
Yeah. You know, every institution has their visiting, even school.
Yeah.
Like when we were in SHS,
yeah.
They were visiting hours. And I think those are the visiting hours that are obliged to the most.
Yeah.
But when it comes to the hospital, Charlie is like,
freestyle.
like just walking at any time. And I think it's one of the things that is not that's not taken seriously.
It's very ignored
in some health facilities. I mean, for where I work, the security men are there. Like they will make sure that
they try. Now they do it. Especially those downstairs, they really try.
Exactly. And somehow they're able to remember the faces of the doctors and the faces.
They're able to distinguish. I don't
Charlie is wild. It's wild.
I've been wondering because sometimes even when I decide to dress casually to come to the hospital,
or exactly not to dress,
or not to even shut at all, like I just want to look like nobody should see me today. Kind of look. And I get to the hospital. These security men are able to distinguish. Because sometimes when you don't do that, when a doctor needs you to go for medication, we can't find you.
Yeah.
You come at a time where you even come at a time where we don't need you. They want to need you.
You are nowhere to be found. And I feel that visiting hours, I mean,
very important.
should be obliged to as well. Yeah. So 0.6,
yeah, 0.6. So 0.6, this one, if you're on admission, stay on admission.
Yeah.
You know why I'm saying this? I mean, in every facility, in every hospital, if you're on admission, that's where you get like the best form of care. But why would you be on admission and be going to town?
You are admitted.
What's there?
You're admitted.
You're not admitted in the house or town. What are you doing in town? You. In town.
Yeah. It's wild. I think it's also very important that we talk about this because like you came to the hospital for a reason.
Yes.
Maybe like your child was spiking temperature or whatever, and you came to the hospital, we took the history, per your history and whatever we've discovered, we need to admit you.
We need to admit
There's a reason. And the patient will go like, boss, can I go home and come back? I'm like,
no.
I want to go and bath and come back. I mean, when you were coming to the hospital, you should have prepared for all these things.
I want to go outside and bring my relative. That's the place.
Wow.
Do you know when you do that, what happens? Because when we call for consults, let's say your problem needs orthopedics consult or it needs ENT consult, and then the emergency doctors put on the page that we need orthopedics or ENT consult, and then they come there and then no one's on the bed. Because now they've not seen you. You came to the hospital so you're in town.
Ward rounds. You go for ward rounds in the morning, Charlie. Like
that. Gone to bar.
Watching.
Huh?
And then they come and we are done with the rounds and they're like, doctor did not see me today. Meanwhile, you're expecting that you'll be discharged. Or it sounds like we're even planning to discharge you, but it's like, Charlie, you are being admitted for another day.
Self-discharge.
Because you went to buy wachi, you see. I mean, some things should just be simple to follow.
Yeah.
Just stay on admission. Yeah. There's a reason why they are nurses. There's a reason why they are doctors on duty all the time. If you need anything, just talk to any of us. Where's your relative? The relative is coming. We call the relative. You see, but you don't tell to the relative.
Yeah, just one in all the roads.
Yeah. I mean, there are situations where the patient does not have any relative around. That's why there are health personnel around.
That's different.
Yes. So once you're on admission, stay on admission.
Stay there.
A patient who has been admitted and is being prepared for theater is in town.
What are you doing in town with appendicitis? What are you doing in town? Because of the pain of the government.
He's going to buy Jimmy.
But like there are some people that like they
Charlie.
have appointments with their hairdressers or seamstresses. So they are in the hospital. It's like, hey, they have to go and meet the woman.
Oh my god. Then
Oh.
under this same point,
Yeah.
patient is on admission. We prescribe paracetamol, metronidazole, patient goes like, doctor, the drugs are not working. I went out to buy my See, it's not a joke, I'm telling you. Patient has been put on specific pain medications.
Okay.
And the patient went to town to buy tramadol.
He
Because
went-
what we gave was not working. We gave buffing, it's not working. And I mean, sometimes yes, it's not working, but talk to the doctor,
Yeah,
talk to
just
the
tell
nurse.
us what your problem is.
You don't go out
You
and
even
then
have
you
an
go and buy your
addiction for
own
tramadol,
medication.
maybe.
Yeah.
Yeah.
You go and buy your own medication. Meanwhile, you're on admission. There's a reason why it's called admission, and there's a reason why we have OPD.
Yeah,
I mean, if you don't know, outpatient department,
yeah.
yeah. And we have IPD, inpatient department. So
Okay,
like,
ICU. Intensive care unit.
I mean, I'm very sure to see an ICU patient by watching.
That one can't. But you know, what about those that will discharge themselves like they're not coming back again? I mean, these ones that will go to town and come back.
Yeah,
better.
actually.
I'll just pick your bag.
You
I don't go home.
you come and then all you see is normal say like. So if you're on admission,
Just
make
stay
sure
there.
you
Just
stay
stay there.
on admission.
You will soon go
Yeah.
home. You'll be well. You'll be fine. You go home.
Yeah.
All right.
And then
Now our final blue.
take a breather.
After spitting all these facts.
And bath.
So don't assume that only your doctor can help you. You get it.
Yeah.
You get.
Yeah.
You get.
Take it again.
Don't assume that only your doctor can help you. Let me give you an example. You come to the hospital, you're looking for doctor. Let me just say Kelvin, Dr. Kelvin.
Yeah.
And I'm like,
Somebody
oh,
good
Dr. Kelvin, yeah, that's right, rightly so. And I said, oh, Dr. Kelvin is not around. You pick your bag and go home. If I tell you that Dr. Kelvin is not around, you say that, oh, but then, is there a way you could help me? I needed this.
Yeah.
Get it done. So,
At the OPD.
for all you know, it's a very simple thing.
Yeah.
Very short. Dr. Kelvin doesn't need to drive
all
the way
exactly.
to the hospital to help you. Do you get me?
Yo. And I think it's normal that everybody has an affiliation to a particular doctor. Like
That's
Angie
right.
has her favorite patient.
Yeah.
Her patient has her favorite doctor. You know, all those things exist. But when you come to the hospital, there are systems. You understand? I think that's one thing that people don't know.
Yeah.
Like, oh, today I didn't meet this doctor. Probably because the doctor is on leave. The doctor has an off day.
Or you came to
He's
the wrong
on night
clinic.
duty.
Probably came to the wrong clinic.
Yeah, he's on night duty. Anything could be the reason why that doctor is not around on that day.
Yeah.
But when I tell you that, oh, this doctor is not around, that, oh, then you assume that then
I can't
cannot
help you.
Yeah, I can't receive the care that I need. You
Yeah.
see, it's not so. Almost every doctor that you see is equally good and equally equipped to handle whatever case that you came with. Do you understand?
Yeah.
So, and you'll be surprised that even the person that you think cannot help you is the one who can actually help you.
The one your doctor will even
imagine
bring you to.
imagine
Do you get me?
and I think it's also because I mean when it comes to ranks, imagine you come to the OPD and then I'm sitting there with my boss, like maybe a
like,
specialist, and I'm like, Charlie.
I can imagine the scene.
It's like because you see me, it's like Charlie, you think I'm the guy, like I'm the one.
Man.
Then we finish and
Your
I'm like,
main man has a main man.
boss, please, what's the plan? Boss, please, what's the plan? And you're like, wait.
Oh yeah, like you tell your boss that, oh no, I'm not looking for me for this other person.
You see, so I think that you shouldn't think that your doctor is the only person who can take care of you.
Yeah.
I have a number of patients who call me like, Charlie, patients having your number. Hey.
We'll talk about it in another video.
This video, yeah. I think we should pause here.
Run.
So I think this has been a very exciting. This is the first of many episodes to come.
Yeah.
I don't know.
Yeah,
some
maybe.
people are on leave, some are not. So I mean, Yeah, but I think that it's going to be educative.
Yeah.
We're going to be learning a lot on these sessions, so stick and stay, as Happy Molecules will say.
Subscribe.
Did you get it? Right. Stick and stay, as Happy Molecules will say. Chalema, your hair is working though.
Gone Blondie.
Hey.
Back with another video.
Yeah.
Bye.